Welcome. I'm Dr. Charley Ferrer, and you're here for another episode of Cancer Tamer. Of course, you know our lovely hosts as well, Debra. And today, I wanted to bring on a special guest. Most of you think about cancer and you think about melanomas, you think about skin cancer. But I also wanted to introduce Dr. Jacob Levitt, who is the Vice Chairman and Program Director, as well as a professor at Mount Sinai Medical Health Center here in New York City. And he's going to talk to us about how cancer can present itself and some of the difficulties that you can experience in relation to cancer. So thank you, Dr. Levitt, for being here with us.
Thank you for having me.
Yeah. So tell us a little bit about yourself so that our viewers can know who we're talking to.
I am a physician, a dermatologist at Mount Sinai, and I focus on medical dermatology. I don't know.
And you wrote a book, too.
Yes, I wrote a book. Safety in office-based dermatologic surgery. It was to teach residents and medical students how not to injure themselves when they're doing procedures.
Yeah, and he's also written quite a few articles, and he does. The first time I saw Dr. Levitt was actually when I was going through some complications with my own breast cancer. And some of the things that we're going to talk to you about today is about different complications that you might see on breast cancer, different complications that you might experience, not only with breast cancer, but also with leukemia and other types of forms. So wanting to get into a little bit about that, and we will, but before that, I want to talk about what type of education do you need for a dermatologist?
Sure. Dermatologists, they go through, obviously, 4 years college, 4 years medical school, 1 year of internship, and then 3 years of dermatology residency. Then after that, if you want to subspecialize, another year or two even of pediatric dermatology, or another year of what's called a surgery fellowship, you can do that as well.
And how much education does the normal physician get? Because I know that once we talked about how plastic surgeons or other physicians that are dealing with cancer, they don't get as much education on dermatology. I mean, how much?
Yeah, so every doctor is very heavily educated in their own specialty, but of course different specialties don't know about the other specialties as much. And then some things get a lot of attention in medical school, like the heart and the lungs, you know, that's primary stuff. But then things like, you know, eye things, ophthalmology, or skin things, or ear, nose, and throat, those kind of things get shortchanged to the general medical school, medical students, and you only learn about them if you do a residency in that specialty. So for example, with dermatology, when I was in medical school, I got 1 hour of dermatology. At my medical school, I taught for many years the dermatology course. They got 10 hours of dermatology. But that's it, and you know, obviously if you can study dermatology for 3 years, 10 hours is kind of sorely inadequate.
Okay.
What are the most common cancers when you're talking about dermatology?
Sure. I mean, so I view, just to make a framework, I view dermatology and skin cancer and cancer interfacing in 3 ways. One, there's cancers that come up from skin cells themselves. So melanoma, or squamous cancer, or basal cancer, and those are the top 3 cancers that we talk about. Then there's if someone has like a cancer like breast cancer and it spreads to the skin. Fine, that's a second thing. And then the third is if you have a cancer inside yourself and it tweaks the immune system to get overactive and attack your own skin, that's like a third kind of interface, how cancer can interface with the skin.
And some of the programs or some of the cancers that we're going to talk about today are actually discussing specific issues. And one of them in particular that I'd like to discuss is sweet syndrome. And it's funny because when you diagnose sweet syndrome with me, and for those of you that haven't been watching the show before, I actually was diagnosed with breast cancer back in February of 2016, underwent a couple of surgeries, and I had a lot of complications, which by the second surgery and new complications arose, they sent me to Dr. Levitt to be able to discuss what was going on and thinking outside the box. And when I went to Dr. Levitt, you actually diagnosed sweet syndrome, which I started getting really upset with, because here you are thinking, you have this horrible disease called cancer, and now you have sweet syndrome, which when I asked you, well, what is that? You go, sweets, as in candy.
And when you told me, I cracked up laughing because I really thought you were kidding around.
Right.
I've never heard of anything
Because I
like
was
that.
thinking, flesh-eating disease, because if you see it, and we're going to show you some pictures about it, it looks really, really horrible. And it does look like your skin is being eaten from the inside out. And we have a couple of pictures, so I want to warn our viewers out there that some of these pictures are going to be a little graphic, and if you're highly sensitive, you might want to close your eyes once the pictures come up. But if we can have a couple of pictures of sweet syndrome so that you can see it, it does look very bad. And we didn't do breast pictures. At this point, we did a couple of leg pictures. But I would love for you to talk about what sweet syndrome is.
Sure.
And
how
it develops.
Of course. So sweet syndrome is actually quite a rare complication of any number of malignancies. Usually it actually occurs with leukemia. And what happens is there's a certain special rash of the skin, and it can look red like what you see there. Sometimes the skin can actually break down. And sometimes what happens is if you injure the skin, like that person had a biopsy there, the inflammation, inappropriate inflammation happens around the injury. It's called pathergy. And you'll get a much larger skin defect or ulcer at the site of that injury. And so, for example, what happened in Dr. Charley's case is she had a surgery for her breast, and around the wound of the surgery, it started to break down.
And it kind of looked like this. This is on a leg, but imagine a breast that was sort of like this as well.
And you can see the purple border there. So what happens is there's actually a diagnostic criteria, like a set of criteria for sweets. And the criteria are: 1, this characteristic rash; 2, it should get better with something called prednisone, which lowers the immune system, so that calms everything down. 3, you have that pathergy thing where a small injury to the skin makes a big ulcer. 4, you should have I'm sorry.
I'll give you the notes.
No. 4, you should have fever. Sorry. 4, you should have fever. 5, you should have an internal malignancy. And 6, there's other markers in the blood that you measure that are elevated. So basically, the problem with sweet syndrome is that you have fever, you have an ulcer, and the ulcer gets bigger at the site of a surgery. And so the first thing that any doctor would think of, because sweets is so rare, right? You think of infection. That's the most common thing that it would be. Someone has fever and an ugly looking wound, it has to be infected. So what do you do with an infected wound with all dead tissue? Well, you got to scrape out the dead tissue and the bacteria, right? And that makes it nice and clean and it should heal. Except with sweets, what did we just say? That if you injure the skin, the wound gets bigger. So you take some wound that was initially ugly looking, you clean it out, it looks great for the first hour, and then starts looking ugly again and gets even bigger. And then they say, oh my gosh, the infection must be getting worse. Our antibiotics that we gave you aren't working. Let's do it again. Let's change the antibiotics. And they clean it out again, and it gets bigger. And at some point, someone says, gee whiz, maybe something funny is going on. Let's get help. And
you hope somebody says that.
And you hope somebody
says that.
Right.
Because I was into my second surgery, and 3-4 weeks after my second surgery, and we're going back to the same thing. And so it is one of those pieces that you said where it'll look good for a couple of hours a day or so, and then you're starting the same process all over again.
That's right.
And the one piece that I was so adamant about getting you on our show was the fact that after all of this happened, my plastic surgeon said, well, I learned something new after 10 years. And I'm thinking, oh my God, I'm not the only one that this could have happened to. There's so many other women out there that may have the same exact thing going on, but nobody's diagnosing it because they don't know to look for it, or they don't, the physicians aren't referring to each other. And that's the bad part.
Yeah.
Right. So I want to know something. if the doctor had diagnosed it quicker, then she wouldn't have had the second surgery. Isn't
Oh
that
yeah,
correct?
yeah. That's completely
so she had to
preventable.
Go through all that pain. It's so sad.
But I don't want to
No.
throw that doctor under the bus, because really the routine. I mean, the appropriate thing to do is think that it's an infection. You have to be really keen as a non-dermatologist to pick up something as rare as Sweet syndrome. So it's not totally unfair. I mean, I think at some point, the person has to be referred, and and that's good. And it's lucky that I figured it out. I mean, that was also
and it was cute because he's sitting there with a magnifying glass, just looking at my boobs, and just going all the way in there and going, oh yeah, that's what it is. And he's like, oh, it's Sweet syndrome. I'm like, what? And he goes, it's sweet like candy. And I'm like, are you kidding me?
So I didn't want to make too light of an issue of it, but sometimes there are people that come in and you diagnose Sweet syndrome. And you say, I think this is Sweet syndrome. If you just do that, you're basically very casually saying, yeah, I think you have, leukemia. And so if they go home and Google Sweet syndrome, they freak out at home. That's the wrong thing. But if you have someone with a known diagnosis of cancer, and then they have a breakdown ulcer, and it's Sweet syndrome, it's like not as big a deal. It's actually good because it's much better than an infection insofar as if it responds to basic treatments, which luckily you did.
Luckily I did.
Yeah.
And and you mentioned not throwing any doctors under the bus, but my piece is that's where we really need to advocate for ourselves, and we really need to, as a patient, as a cancer patient, as any kind of patient, you need to advocate for yourself. Talk to your doctor and say, hey, this isn't getting better, because that's what I was doing with my physician, and I was actually, holding little rulers and stuff to my breast, going, it's getting bigger. It's no longer, 2-3 centimeters. Now it's 6. Now it's 7, and it's getting worse. And so you have to advocate for yourself, and also. Most doctors stay in their specialty, and so they try to heal from their specialty, which is a wonderful thing. That's why you go to them. However, it is bringing in other physicians. It is bringing in a dermatologist, and I think, in my opinion, the dermatologist and the plastic surgeon should always be together. They should be, because, you're talking about the skin, especially in the breast cancer area. You're talking about the skin and how that relates in any kind of cancer, because you also have different kinds of cancers that are represented in different ways. And so it's so important to look at that. Also the fact that, I had breast cancer, and now I have an immune disorder, and now I have more symptoms. So that's why doctors really need to be talking to each other. And if your doctor isn't talking to someone else, or you're listening to our show or any other of our shows, by all means say, hey, maybe it might be this, and advocate for yourself.
Now, just a couple of things. One, with Sweet syndrome in particular, you're obliged to do a swab culture and make sure there's no bacteria. That's number one. Number two, the skin and certain aspects of the skin cross specialties. So like a plastic surgeon is really good at sewing up the skin, and a dermatologic surgeon is also really good at sewing up the skin. And sometimes they overlap. They both do Botox. They both do, cut out bad wounds and do reconstruction. And maybe the plastic surgeons are doing more intense reconstructions than the dermatology surgeons. But there is a lot of overlap. So again, I can definitely see the reluctance of a surgeon to call for help. But and I totally agree with you. You have to advocate for yourself. If something is just not going right, ask for a second opinion. And a really good doctor shouldn't mind someone having a second opinion. And a really open-minded doctor will actually be open to, hey, wow, that was a good idea. No one wants to admit, like, I missed something, because then you fear of getting sued. But at the end of the day, they always say be open with the patient, and mostly you're forgiven if that happens, so long as your intent is to do good by the patient.
And you're honest, and again with advocating, because a lot of people feel that they don't have the confidence to advocate, but it's very important, because you are your best person to take care of, and you know when something's wrong. Like, you knew right away something was wrong, and you did the right thing. You kept going back to the surgeon. You even had to go to the hospital because your infection was high, and you had a high fever, whatnot. And if you weren't adamant about what you were doing, who knows what would have happened? I mean, you could have lost everything. And the fear of The Walking Dead. Okay, she was so afraid of zombie skin.
Well, we were, and I'll help that one along so that you know what we're talking about. But I have this fear of zombies, and just so. And so I was thinking, so I had this fear of zombies, and so we were getting to the point where my skin was getting so necrotic, and I'm worried that my nipple is going to fall off into my hand, and I'm seeing all this black skin all around my breast, and so I'm thinking, oh my God, now you're going to give me cadaver skin, and so that's another option too that might be possible. So now I have dead people's skin on me. And, of course, transplants are great, but in my head, I'm thinking zombie. And then when you are on cancer medication, then you start getting what I call the cancer shuffle. So I'm starting to walk funny, plus I'm going to get cadaver skin. I'll be, set me up for an episode of The Walking Dead, and I'll fit right in.
That was a fear,
I mean, and we joke about this, and if you've seen a couple of our shows, Debra and I joke about this quite often because it is a way of coping for us. Because we've both had breast cancer. Debra also has leukemia, so she's got one step further. And if you're not advocating for yourself and you're not keeping a good attitude, then you end up falling into depression, you end up falling into other issues, and your condition can actually get worse. And that's what we're trying to avoid. We talk a lot on the show about advocacy because sometimes you're by yourself. I mean, I'm going through cancer by myself. My son lives in Washington State, and he's young, and his thing is he's terrified that he's going to lose me, and he wrote me this beautiful card that said, Mom, I don't want you to have cancer, and the thought of you not being here is just terrifying me. And so we don't talk about my cancer. And so so I'm basically doing this by myself and trying to see what to do. And I go to Debra and I say, Debra, can you believe this, or what's new, or tell me what to do. And so I'm a big advocate also for support groups. Because support groups are so important, because that's where I met Debra.
Yeah, we met there, believe it or
we
not.
met at a support group, a cancer support group, and we went from there, and just her helping me, and talking me through things, and then she was on the phone with me, here's another doctor you can go to and try this one and try this one.
I'm always the resource person.
Yes, and she is the resource person, not only for me personally, but also for our show. So Debra's always looking up information, and if you have questions, and I'll throw this in there, if you have questions or comments, please feel free. Call us out. Email us at info@cancertamer.com and go to our website, which we're going to have tons of information there. And also, Dr. Levitt was kind enough to give us a whole list of symptoms and different cancer-related conditions, dermatological conditions that you can see and you can go through it. It's not for you to freak out. It's not for you to freak out that, oh my God, I have cancer because I have a rash, or I have this, or I have that. But it's a wonderful resource for you to then go to your doctor and say, hey, can you check this out? Hey, can you do blood work? Hey, can you help me out? Or can you refer me to a dermatologist so that they can check me out?
That knows what they're doing. Can I just say? Yeah. Okay, I'm sorry. Now, what I want to know about the sweet syndrome, does it have to do with diet? Is it a diet-based problem that gets you to that point?
I would say that these days there's a lot of attention put to, my diet is causing my whatever the health problem it is. I haven't been a big, kind of believer in that. I think there's some truth to it, and definitely there's cause and effect for some folks. But it's more of just like an inflammation thing. And you just need to, cure the underlying malignancy and also give appropriate, anti-inflammatory, prednisone or whatever you're going to need to make this thing go away, and you can clear it.
Are there any precautions to take before surgery so that you don't get to that point?
You can't predict who's going to get sweets and who's not, and it's so rare. I mean, 9,000 times out of, 10,000, but you're not going to get sweet syndrome, and it's not even a consideration. It's just if you see something is going wrong, then you have to say, okay, well, something's going wrong with this wound. Maybe it's Sweet syndrome.
And considering thinking outside the box, because that was the beauty for the second opinion that I had on my surgery. When I went to her and I'm like, look, this isn't working. I'm already at my second surgery. What's going on? And she couldn't figure it out either. And she goes, well, let's think outside the box.
Yeah.
And that's what I loved about it. It's like, let's think outside the box. And that's where she did a special call to you and said, hey, can you get her in for me?
I would like to just say one point about advocacy, for your self-advocacy to your physician. It's really important, I think, to be as polite and politically sensitive as possible with your physician. If you're obnoxious or rude to the nurse answering the phone and making all kinds of demands, and then really, I mean, you have to politely question, but you can't flatly say, you're wrong. You know, no person likes to hear they're wrong. And that's the doctor who's still in charge of your care, and you want them to be on the same team as you, not adversarial. So you have to figure out how to negotiate that, but you also can't compromise your own health.
Right. And it is, I mean, and when we say advocate, of course, we never tell you to go and say, hey, you're an idiot, you know, what are you doing? But you know,
people sabotage themselves.
Yes, don't sabotage yourself, but be forceful if you need to be. You know, say, please send me to somewhere else, because I've done that. You know, I mean, some of the doctors that I've had during my care have been wonderful. Some have been, oh my God, I want to strangle them.
Right.
You know, and some of them I won't even discuss. But it is that piece of continuously saying, hey, this isn't working. Or if you have the one piece that I do say, if you have a concern, then be at your doctor's office every week and say, no, I don't want to come back 3 weeks later or a month later, because sometimes they do tell you, we'll come back in a month and we'll see what happens.
Listen,
but you can document, and one of the things that I did to show, because of the fact that doctors are seeing a lot of patients, and so they might see your, you know, in particular we're talking about breast, so they might see your breast and go, oh, well, you know, it hasn't gotten worse. But what I did for myself was that I was taking pictures every day, and I was measuring, and I was, you know, holding the little ruler up and going, it's bigger, it's bigger, it's bigger. So I was able to become, you know, my doctor's assistant and say, look, it is getting worse, it is getting worse. So we had documentation that it was getting worse, and so he took the next step. And so that's something that you could do for yourself to help you, to help your doctor,
Sure.
to be able to do that so that they continue to work with you. And you do want to make sure that you're working with your doctor, not against them.
And the doctors understand that there's a psychological component to this, and even if they know in their heart of hearts that you're going to get better, they still will allow you to come back in a week, more for your psychological,
Yes.
you know, sanity. And that's a big part of it. If the patient feels good and safe, then they're going to heal better. I mean, there's a big connection between mind and body, and that's well established.
So I know you use steroids or cortisone for to get rid of the inflammation. Besides that, does a person need vitamins or herbs or any oils, or, you know?
I think that vitamins, herbs, oils, unless the doctor specifically says to take them, there is a chance of like drug interactions. Maybe it makes your blood too thin, or maybe it interferes with some other medicine. You just want to be careful about being your own doctor in that way. But many times the herbs are neutral or beneficial. There wouldn't be like perfect proof about it, but it's always good to get the okay from the doctor about it.
Yeah, so it's okay to play doctor, but not okay to play doctor in real life and dictate what you need to do. But you can say, hey, is this okay for me to take? Is that okay? And as he said, as Dr. Levitt said, there are interactions that happen, so be very careful with that. And don't put anything on your wound that the doctor hasn't prescribed. There's a lot of home remedies out there. I know my sister was constantly telling me, well, do hydrogen peroxide, which she actually loved when Dr. Levitt finally said, yeah, put a little bit of hydrogen peroxide here. So, but, you know, my whole point here is to be very careful about what you do for yourself and run it through your doctor first. Again, use your doctor, use his office, use your friends, use your family as a part of your team and as advocates. If you have questions, I know I'm speaking for Dr. Levitt here, but if you have questions on dermatology and Sweet syndrome, send us some questions and maybe we can get him to respond, and we'll have him on our website. So hopefully he'll come on board and be our dermatologist consultant.
I'll do my best.
And so that we're always looking for wonderful leaders, and you know, you can't ask for better than him. I also wanted to, you know, briefly, because we're almost at the end of our show, but when when you're having these treatments, it's not a one-time shot. It's a process. So you're actually having a couple of shots once a week, and then then after a while you're having them more often. Is there any complications or less frequently? Yeah. Is there any complications that they should look for?
Well, I mean, in the treatment of Sweet specifically, usually you start with injections with steroids locally. If that doesn't work, you may give prednisone. If that doesn't work, there's other things you can do. There's not honestly that many side effects. When you inject locally, you can get thinning of the skin, so the area will heal. You'll have a scar, but the scar will be kind of thin and it'll be kind of red and purpley, and there are lasers to fix that up later once it's all settled out. But actually, fortunately, there's not like crazy bad detrimental side effects.
Right, and that's one thing to consider too, that because your skin is healing a little bit slower, for those of you that need to undergo radiation, then you also want to talk to your doctor about when it would be appropriate for you to start your radiation treatments, because you need that skin to firm up a little bit more before going into it. And we're almost at the end of our show here. So we are asking Dr. Levitt to come back because there's so much more that we want to talk about. And if you are interested in learning more, by all means, come to our website and get more information at www.cancertamer.org. We invite you to send in questions. We invite you to send in show ideas. If you think there's a topic that you would like us to research or discuss, we'll always look for a physician to come on board. And again, Debra always does some wonderful research for us. We've been a little shy on time and being able to get her to do her segment on Did You Know, but we will have those on the website as well, so make sure you do that.
It was great. It was great to have this time to meet you.
Thank you so much.
Talk about all this. And
that was really wonderful. It was an honor and a pleasure.
Yes,
thank you.
I really appreciate it.
So thanks for watching, everyone.
Thank you.